Hi, it's a pleasure having you once again on the program Transforming Lives One at a Time. I am your host, Dianne Mcletchie, and of course we are coming to you from scenic Tobago in the Twin Island Republic of Trinidad and Tobago. So maybe you're looking for the next vacation. Tobago just might be that spot. Well, of course, on this program, we delve into any and every topic that affects the human experience. And today is no different. On the program today, we seek to provide pertinent information on topics that are very, very important to all of us. Today, my guest is a household name in Tobago in the person of Dr. Oganna Okeke. Dr. Okeke is a specialist medical officer in internal medicine. He is the head of the Department of Medicine at the Scarborough General Hospital right here in Tobago. Dr. Okeke, welcome to the program, Transforming Lives One at a Time.
Good morning and thank you for having me.
Yes, it's my pleasure. Well, Doc, within recent times, there has been an upsurge in the number of persons falling victims to strokes and heart attack. And I felt it was very critical for us to address the issue as a matter of grave concern, as many are not aware of the symptoms, the causes, and of course the effects. So at the end of this program, I really want the general populace to get a very clear picture as to what we are dealing with when we talk strokes and heart attacks. So first, let's lay a proper foundation as we get into the discourse. What exactly is a stroke and a heart attack?
Okay, we all living human beings, organisms, and we are composed of cells, tissues, and organs. To stay alive, they require a constant flow of oxygen and nutrients delivered by the blood. If for any reason that blood supply of oxygen and nutrients are interrupted, the tissue dies. So if there's an interruption that blood supply to the brain tissue, that part of the brain that is not getting sufficient blood supply, either from occlusion or decreased blood supply, necroses and dies. And the death of that part of the brain is what is known as a stroke. It has its manifestations based on which part of the body it controls. Similarly, in the case of the heart has its blood supply from what is called coronary arteries. There are two main ones, the right and left coronary artery, of which the left divides into a second branch, the circumflex and the anterior descending, and then tributaries. If any of those tributaries or the main branches get occluded with a clot, the muscle distal to it dies, and then the heart is called a heart attack. And as we go on, we'll say what those symptoms and signs would be.
Right. So what are the most common warning signs of a heart attack? And are there any subtle symptoms that people may miss?
Okay, the classical symptoms of a heart attack are the ones you see in the movies. The person holds their chest, they are gasping, they are saying, oh my God, some even fall down and die. But in reality, people describe an impending heart attack as a pressure sensation. Some people may say it's a squeezing, other people may even say it feels like someone standing on their chest.
Okay.
Other people describe it as a feeling of doom and gloom, something bad is about to happen to me. Besides that, they might start to feel faintish, they may feel dizzy, or they may feel they may start being aware of the heartbeat, palpitations. Others may also feel sudden shortness of breath, giddiness, and they might even start cold sweating. Some people may even describe, besides heaviness, they might feel pain radiating to the jaw, to their neck, sometimes even to the left arm. And the chest pains, besides the feeling of pressure, and it could also feel like pinpricks for some people. Some people may not even feel any of those things, especially women, and that's why sometimes women are misdiagnosed. They have smaller coronary arteries, and maybe they are tougher, I don't know, but they tend to feel their symptoms more like an indigestion. They say they feel like they have a gas, and they might see the doctor or even go by the pharmacist, and they take medication for acid, and they actually might feel better, but they're still falling down the cliff until something bigger happens. Other people may just feel tired. Other people may, and the elderly may just become unresponsive, comatose. Okay. So there are a variety of symptoms that do occur with a heart attack. With a stroke, the feelings are usually sudden. The person was feeling good a minute ago, and next minute they start to feel lightheadedness. They might vomit. They might have a very bad headache, depending on what type of stroke it is. They may have visual problems, blurring of vision. But the more common thing people describe is that they're sitting at the table and the person is not talking. They have a heaviness of the tongue. Okay. The face looks like it's twisting. And for others, if there's a weakness, they could just suddenly fall. Or they may just be comatose in bed when they're found, if it's the elderly. And sadly, some first presentation may be death.
Yes.
Which is the extreme.
Wow. This is a very serious, and within, as I said in my opening, within the last few years, the figures have just been skyrocketing. What can we?
Okay. The figures are gradually increasing, but I wouldn't say skyrocketing. I think we're now collecting more data.
Okay.
Or more people are presenting to the hospital, because if things happen at home, some people may not present and they may call it something else.
Right.
Some superstitious one may even think it's their neighbor do them that.
That
so the other things that, to use the local parlance. But yes, the reason is these things keep going on is it comes with the modern lifestyle.
Okay.
The basis, and talking about strokes, we have distinguished the two types of strokes. There are ones that occur as a result of atherosclerosis, which is hardening of blood vessels. And that is hardening of blood vessels all over the body, not just in the brain. It just depends on which decompensates first. And that comes with long-standing chronic communicable diseases like diabetes, high blood pressure, right, high cholesterol, smoking, sedentary lifestyle, and things of that nature, if they're not detected early and under control. Over time, the blood vessels, which are supposed to be nice and supple, like when you buy a new rubber hose to water the garden, right, it's very soft. But over time, when the calcium and build up there, it becomes hard and could dry rot and burst.
Yes.
In terms of the body, it just thickens and gets harder, and there's something called plaque, a buildup of fat tissue and calcifications, which narrow and slow down the blood supply. But if that plaque ruptures at some point, it's the bleeding, and trying to stop the internal bleeding within that endothelial lining, platelets come and a clot forms, and a clot just causes that acute occlusion, which impedes the blood supply and gives you that initial thing. So the lifestyle that people have had back in the day, when there are not too many automotives and there was not instant this, instant that.
Yes.
People used to exercise, walk. They had to walk to distances to do things. They had to do outdoor work. Children climbed trees, played, rode bicycles. Nowadays, people are chauffeured in, well, not even just, they go in the buses, they go in their private vehicles. Yes. They have their tablets, phones. People are not outside.
Yes.
You WhatsApp someone, you don't have to go see them. In fact, some people, just to pass the salt across the table, they text you.
In the same house, and they're sending a message.
And then they have they have a variety of TV channels. Back in the day, the TV just came on a few hours a day. Now they have endless channels, so people become couch potatoes. There's no incentive for them. And then to keep the children quiet, parents will give them all these nice snacks, cake, ice cream, and all that. So the lifestyle, being in a more modern world,
yes,
decreases exercise, makes us make bad choices in food, and so on. And those things will lead to atherosclerosis and the thrombotic stroke. The other one, Occlusive stroke is people who may have a heart problem where there's an abnormal heart rhythm that could generate a clot. And if the clot leaves the heart and goes up the blood vessel to the brain, it could cause a sudden occlusion. That one comes without warning.
Okay.
And then the other one is the bleeding. So far we've talked of blockages, but with the bleeding, it's a blood vessel in the brain that could burst. And that blood vessel, typically, most times, it's been weakened either from long-standing high blood pressure, or genetically they had an aneurysm, which is a weakened blood vessel that is just waiting to burst. It's sagging walls, not as strong, so that when the pressure goes high or something acute happens, it could burst and it could bleed. And the brain doesn't, if you bleed anywhere on the body, there's an outlet, the blood comes out, but the brain is encased, so the blood starts putting pressure on the healthy brain and worsens the poor circulation and availability of nutrients, and then the brain swells up, and that part of the brain, when it dies, it's also called a stroke. So,
okay.
So high blood pressure, bad lifestyles, genetic problems could do that. And then you have people that are prone to strokes for a different reason, not to do with their lifestyle, but just to do with the genetics. For instance, sickle cell.
Yes.
Occasionally, the cells could sickle wrongly and block up a brain vessel. Sometimes in pregnancy, there's something called preeclampsia.
Yes.
And there's a HELLP syndrome that comes with that. So high blood pressure, if not controlled, could cause bleeding in the brain. Pregnancy is also a hypercoagulable state in which it's rare but could occur. People could have a stroke in pregnancy
During
or
pregnancy.
just after pregnancy, yes. So those ones are difficult to tell them, do this, do that, do that. Even in the best care, so strokes would do happen, but the question is prevention and minimizing them, because...
Yes, certainly, certainly. Well, doctor, what is the acronym for recognizing stroke symptoms? Well, we touched a little bit on it. And what makes it such a time-sensitive emergency? And should an ambulance be called, or you just get the individual to the hospital in the quickest possible time?
Okay, in terms of acronyms, there have been several, but there's one that seems to be the most popular. And actually, it's Be Fast, you know. So B-E, like to be,
right.
Fast, Be Fast. So B stands for balance. So balance, as you're standing, you're well balanced, you're
yes.
walking, you don't fall, but your balance centers are regulated through the brain stem, the cerebellum, and then the joint system. So you know, and even your eyes help with the balance. So if one part of the brain where the balance is controlled gets damaged, the other side is working and this side is not working, it creates, the brain gets confused and the person could get dizzy,
okay.
And have vertigo and might even feel to fall down, some vomit. So this occurs suddenly. It's not like they were having it before they came off the boat or something like that. They just fine, and then that happens. The E stands for eye, which is eyesight, sudden blurring of vision. I mean, if you have blurred vision for even a fraction of a second, that's going to be scary, let alone it's progressing. And it could be several types of things could be occurring. One could be the part of the brain that processes your vision. Is not, the eyes see what they see, but it's processed in the back of the brain. It's known as the occipital lobe. If you have any type of damage there, that part of the eye that is controlled by that brain, the vision goes. So that's one. And the other is the muscles that control the movement of the eyeballs. They're controlled by something called cranial nerves, which also come from the brain. So you may have even problems with the two eyes not moving together, and you have what they call diplopia, that is double vision, or squint. So that is the E in the Be Fast. Yeah. Then you also have the speech, which is the S in the Fast. You could have a slurring of speech, heavy tongue. Sometimes you cannot even talk. at all.
Okay.
The A in the fast is the arm and the leg. So one side of the body would the left side of the brain controls the right side of the body, and the right side of the brain controls the left side of the body.
Okay.
So let's say it occurred on the left side of the body, the left side of the brain, which for right-handed people also has a speech center known as the Broca's area. Speech may go, but that side gets weak. Now, if it's weak but usable, it's called paresis. It's just you can't really hold something or stand fully on it. But if it's completely gone, it's called plegia. You can't even at all use that limb. It just goes, and you find that you fall towards that side and thing. The F, sorry, I skipped the F. F represents the face, which you could see facial asymmetry, the drooping of the face. That one is somebody who see it. Sometimes you don't even know. Someone is saying, but you're looking strange. And you might have a drooling from the side of your mouth. And the last part of the thing is a T, which is time. And you brought it up. Time is of the essence.
Right.
You really have, in fact, in countries that have the resources, because this is not just time sensitive, you also have to have those resources. The whole idea is before that brain tissue, from time it's recognized a stroke is occurring, and before the brain tissue dies, it's ischemic, it's weak, it's like something getting weaker. It's like you're holding your breath and you're like passing out, but oxygen comes, you recover.
Right.
But if you hold to a point where eventually it goes, you collapse. So in this case, the time is to reopen that blocked circulation or restore circulation one way or the other. And it's just a matter of hours before it becomes too late. Yeah. So in the advanced countries, they have what they call stroke ambulances.
Oh.
Yeah, so you call and those ambulances, and they're equipped with one is they have scans, CT scans.
Okay.
Because the thing with a stroke is to know what type of stroke you're having. If it's an ischemic stroke, which is a blood clot or thrombus, means something's occluding flow, you need to
work fast
and remove either by clot busting treatment, drugs, like tenecteplase, tissue plasminogen activators, or mechanically, invasively go in and take out the clot. But supposing it's a bleed.
Right. So you just
that's
have
a
to
whole
get
different thing. So,
to the hospital.
No. So if it's a clot, you could give the medication right away, and some of those people are trained, they are skilled, they're not just ordinary nurses. So they give it on the spot, so by the time you get to hospital, problem solved.
Of course.
But God forbid it's a bleed and you give a clot busting
problems.
Like this, you're going to then finish off the patient because they're going to bleed faster. So the scan is so critical.
Yes.
And sometimes that not scanning a patient causes delay in treatment because somebody wanting to treat does not want to move from being the hero to becoming the goat, because if you do give the wrong treatment, the whole family will blame you. But if you delay the treatment, at least you didn't cause any harm because you're waiting to make sure you're giving the treatment.
Yes.
So they do the scan. But if they get to the hospital, because if the ambulance can do it and they get you to the hospital, you're getting a scan one time, no ifs, ands, or buts, unless you need to be stabilized before going there. And then the scan would tell you, the scan tells you if there's a bleed or if there's a ischemia, a blockage. Now, sometimes a blockage won't show. You may do a CT scan for those who did a scan, who had stroke symptoms, and they did a scan and the scan looked normal. Sometimes the brain scan looks normal because it has taken time for the death to be fully seen.
Right, so it's kind of tricky.
Exactly, so it's like if you pour pitch on grass, kerosene or any of those things, the grass still looks green. Or even if you cut a flower and give somebody on, say, maybe Valentine's Day or birthday, it's looking fresh, but by the next day, it's dead. But you know the plant is dead, it's not going anywhere. But if there's a bleed, you see it right away. It's a whitish thing you see right away. So if it's a bleed, you know not to give aspirin or any of those.
Right, and of course we're going to talk about aspirin a little later, but we're going to take a short break at this time and we'll be back. You're viewing Transforming Lives One at a Time. We are speaking about strokes and heart attack. Stay with us.
If you're wondering where to find top-tier quality tiles and products to refurbish or renovate your wall, floor or pool, well, your worry is over. Come to D-Cell's Tile and Ceiling Center, Store Bay Local Road, opposite the Bonaccord Primary School, Tobago, where you will find porcelain, mosaic, and ceramic tiles of the highest quality guaranteed. D-Cell's Tile and Ceiling Center also stocks thinset, grout, tile cutters, and yes, windows. Plus, a friendly smile and service that's second to none awaits you. So forget the hassle and get all the quality tiles you need right here in Tobago at D-Cell's Tile and Ceiling Center. Call us today at 460-8802, 639-8281. Opens Monday to Saturday from 9 a.m.
Powerlink Graphic Enterprise, Storby Local Road, Crown Point, Tobago, for a variety of quality printing products, including banners, posters, jerseys, flyers, and more. Graduation packages, get customized grad bags, mugs, newspapers, and the list goes on. Powerlink Graphic Enterprise, open Monday to Saturday from 9 a.m. Call 269-6996. We create ideas that inspire. Are you having issues with your vehicle overheating? No worries. Check out Graham's Radiator Service for sales and servicing of radiators, installation and flushing, pressure testing, gas tank recoating, and all your radiator needs. Check them out at Philadelphia Trace off the Plymouth Main Road in Marys Hill, Tobago, seconds from the Wim Anglican School. Call 639-1094 or 299-3097. Open Monday to Saturday from 8 a.m. Welcome back. My guest today is Dr. Okeke. Doc, based on my research, I know there is a link as it relates to high blood pressure and high cholesterol in contributing to cardiovascular and brain health. How often should person have their levels checked to prevent another occurrence of a stroke or a heart attack?
Okay, thank you. Your observations are correct. Permit me to add a few more risk factors. In fact, diabetes is probably very big in the dance in this, and causes a whole, because diabetes is like having sea blast in your blood vessels if not controlled. So the big three are diabetes, hypertension, as you rightly mentioned, and high cholesterol, or dyslipidemia as it's called. Those ones, you'll have the other modifiable risk like smoking, obesity, and all that, but these three are high up there. So first of all, most times people get an encounter with healthcare, maybe during school as part of their physical exam, or part of if you have to get into university, you have to bring some doctor's report.
Yes.
So a lot of times people get to at least have a baseline of what their blood sugar and blood pressures are. But at a young age, unless you have type 1 diabetes or some other condition that make or mask it, young people don't tend to show up with these chronic diseases. That's why it's chronic,
right,
non-communicable. And it's not because one has it that they are going to see complications right away. It has to have been sustained for many years, showing up maybe by the late 30s, early 40s, if one has been having it for more than 10 years above. So I say by the time you get to your 20s and 30s, at least you should have had at least one cholesterol and one blood sugar test,
right,
and had your blood pressure checked. These days you have blood pressure machines that people could buy at the pharmacy. So if you want to check it every minute, every day, that's up to you, although that could also give anxiety.
Exactly.
Because the best blood pressure actually is the one you do at home.
Okay.
Most people go to a doctor's office and have high pressures, and that is
because they're scared.
Simply, even to go for an exam, to go for anything, even to wait for an appointment, or you're waiting for a phone call or something, there's a certain level of apprehension. So, yes. But if you're at home, in the hospital, you see some very high pressures that may trigger someone to want to give you something. But when you go home and you do it, that's the best reading. So you could do it as often as possible, at least
right,
3 times a week for blood pressure, even when you're feeling well. Because high blood pressure is a silent killer.
Yes.
You don't feel it, so it's the one that actually gets most people. They don't realize it. With diabetes, sometimes you may pick up on those signs and symptoms. You're peeing a lot, you're always thirsty, you see ants coming around certain places. But ideally, you're not waiting for that to happen. At least you get it checked. And if you have a family history, you have to know your family's history. You have a lot of relatives, close first-degree relatives,
Yes.
maybe father, mother, brother, sister, and that sort of thing, who are diabetic. Curiosity, you may want to get it checked out. With cholesterol, that's the one most people, it's like esoteric. Nobody really thinks about that. They don't eat fat, they don't eat this and that, but that is equally important. Before, a long time ago, they say you have to do it fasting, but over the past few years, they found that you don't have to do it fasting. You could have it tested at any point in time. It's called a lipid profile.
Right.
And it consists of both good and bad cholesterol, but the doctors will be able to interpret it and see. So that, if it's found to be high, one could then do certain things, diet, exercise, and if you need cholesterol lowering medications,
Okay.
they could do that. And then you have to wait a little bit of time to go and check to see if it's working. It's usually about 6 weeks to 2 months after the initial, you start doing the right thing. And then if it's going well, then you could do it maybe 3 times a year, twice a year. But if it's not going good, then you keep doing
More
it
frequently.
based on the doctor's recommendation, because you're not treating yourself. And so the doctors would decide that if there's a problem. Let me put this way, if there's a problem and you see the doctor, they're going to decide, because every individual is different.
Yes.
But on your own, at least, anybody listening to the program should at least check it once and see an abnormality, they go to see the doctor. Sugar, cholesterol are lab tests, and blood pressure, you could do that with a blood pressure machine anytime you want that at home. But taking into cognizance that you have to do it in a particular way. Relaxed, wait 5 minutes, make sure you didn't smoke or drink coffee. Because if you open the door and you see a lion, your pressure will go up.
Of course.
Yeah, so you can't use that as, so you have to do it the proper way.
Yes.
Yeah.
Well, Doc, I know that unfortunately many persons do not survive a heart attack and a stroke based on the magnitude of it. Some family members would have been told, yes, your loved one suffered a massive heart attack. I know it can be mild or it could be massive. I want us to weigh in, tell us about that in terms of what are some of the reasons it could be mild? Is it a continuous buildup of the plaque that you spoke about earlier?
Well, I'll call it mild if you're still alive after the heart attack.
Okay.
You know.
I like the thought of that. It's mild if you're alive.
And it's massive if you're
if that's it.
If that's it, or you're there
and
you can't function at all.
Right.
But I get the concept, your logic you're using. It's a question of luck. If you are involved in a car accident, sometimes you could have a mild fender bender, or the car could be totaled with people inside there. So there's not one where the important thing is that something has happened. In fact, the heart attack spectrum is referred in medicine as acute coronary syndrome, because it's something that happens acute. 1 minute, things are good, and next minute, especially when it happens the first time. The other ones would be recurrent, whatever it is. The heart is it's something that one has to pay attention to, because if you break a limb, God forbid, or something happens you could rest it, you could treat it and stop it, but the heart never stops, because when the heart stops, that's it. So the heart itself requires nutrients, it requires oxygen, as it also gives the body oxygen and nutrients. So that if it has any occlusion to any part of its muscle and it keeps pumping, it's going to start feeling like the way you feel, what do they call it, cramps in the legs?
Yes.
When you have cramps in the leg, you could stop. But no, I feel like muscle bumps, they call it.
Okay, yeah.
Yeah, the heart can't stop and rest, so it will just keep going until it finally. So if that muscle dies off, okay, then the muscle wouldn't work again.
Right.
So there's less pumping activity, and when there's less pumping activity, there's backup of fluid into the lungs and into the limbs backwards. So you may have swelling of the feet, shortness of breath, pulmonary edema when it gets so bad. So that's just one, depending on how severe it is. The other thing is arrhythmias. The heart is also has its heartbeat from electrical impulses coming from something known as sinoatrial node, SA node. And these are organized. If the person is running, heart needs to beat faster,
Yes.
it will generate faster. If the person relax, it will slower. Come back, regulated through the brain and through the SA node. So, but if that part of the heart and the other conductive systems die off or experience ischemia, they start acting like if you poured water down the computer, everything starts.
Right.
And the heart could start beating very regularly, and that arrhythmia could lead to something they call ventricular fibrillation, which is just the heart quivering, and technically the heart isn't beating, and the person could drop down, and if not, the person could die. So it's not just a pump problem, it's also a rhythm problem as well. So that some people may present as the mild one, you say,
yes,
and in other people it could present as the more severe one, where the heart muscle is so dead that they rely on so many medications just to get through the day, and the other is obviously sudden death. So the terminologies for the acute coronary syndromes would be ST elevation myocardial infarction, which is the testing you do with an ECG. That one is the one you're required to do some mechanically invasive treatment, like right away, percutaneous intervention, or give thrombolytics, and the other one is the non-ST elevation MI, which you could still do your percutaneous intervention, but you're not going to use thrombolytics because the risk-benefit of thrombolytics isn't worth it.
Okay. Yeah. So when for the person who have experienced a stroke or a heart attack, how does it typically change their lives? I mean, we're talking about their mobility, their diet, their family life. Just weigh in on that.
Well, I think this is the one that should get the attention of anybody if they haven't been listening and they haven't followed. This is real life. All we've been talking about so far is about damage to the heart and to the brain. But starting with the stroke, think about it. What the person is going to lose is beyond just independence. Now, if it's a mild stroke, and we could always talk about how you deal with it later, they may recover and no problem. But if it's a significant stroke, let's say moderate to severe, traditionally it could take the vision. You can imagine if you can't see very good and you put on glasses, still can't see very good, how life would be. Yeah. Of course, you can't, as a doctor, you won't be able to even operate or do anything like that. Of course, you can't drive anymore and things like that. Imagine if it affects half of your body, because the left side of the brain controls the right side of the body. It means that you may have to rely on to maintain your balance so you don't fall with a cane, or that's if it's hemiparesis, or if it's no power at all there, a wheelchair. So a cane or a walker or a wheelchair. And for those people who maybe, they're a little well off or they inherited and have that very nice big parlor and bedroom upstairs.
Wow.
And then the servants' quarters downstairs, a small guest room. They would have to relocate to that guest room, and whoever is taking care of them could stay upstairs in the thing. I'm just using,
yes, of course.
Although that may not matter to the person at that point in time. So we've talked about you're moving around, your mobility is impaired. Imagine needing to go to the bathroom and you're waiting for someone to take you to the bathroom and see your nakedness as they help you take off your clothes. Sometimes there's incontinence, they have to change the pipers out and wipe you. Somebody who was so proud and stand up. And so on. You can imagine a female, you dress well, you wear your high heels, you can't do that anymore. But let's even go into the ones that even nobody could help one with. We used to, when I was in secondary school, there's meal times, we're in boarding house. There's this song they sing, some have food but cannot eat. Some can eat but have no food.
Yes.
We have food and we can eat. For this we thank thee, O God. O Lord. We take certain basic body functions for granted.
True.
So that with a stroke, sometimes the person may be left without being able to swallow.
Wow.
Yes. Or if they can swallow, they cannot protect their airways. Remember, they say don't talk while you're eating, because when you're talking, you open your breathing tube for food to get in. When it can't close because there's no coordination to a stroke, people could aspirate. And if you aspirate, it means food or drink or saliva, even basic saliva, goes down the wrong way and could cause a pneumonia, which could end up in hospital and cause critical illness.
Wow.
And for some people, the only form of gratification, they don't drink, they don't smoke, they don't go out to party, they don't do any of these things they say they shouldn't do. And the only gratification is at least eat some good food for the day. And you can't even eat that. And then the worst part is they put a tube down your nose called a nasogastric tube and feeding you things that if you, let's say you're allergic to milk or you have lactose intolerance, you're having diarrheas now, or they have to crush the thing, sometimes they don't go through the tube, and then your medications too have to be crushed. And this is something you have to rely on people of goodwill, and that is why you have to be good in life, because if you're bad, people will not be interested in helping you out. So your nutrition and your medication is not always guaranteed, and that tube over time could start even causing corrosions in the nose and cause pain, and you can't even complain to anybody, because if they take it out, there's nothing left. They might sometimes have to take the tube out and put that tube directly into the stomach. But the point is, either way, you're not getting the taste of the food, so you're not looking forward to meal times, you're not looking forward to it. So that part of your joy is gone. What about your employer? Over here, people, no matter how much empathy they have,
they have to
be profits, you have to be useful.
They have to move on.
And therefore, at some point, sick leave, benefits are gone, and they have to let you go because they have other people waiting for the job.
Of course.
Yeah, so you could imagine if you're the breadwinner for the family, it means school fees may not get paid, you may not be able to pay your mortgage, you may not be able to even, well, fortunately, there's still free medical care, but in places where there's no free medical care, you may have to sell things just to pay for your own survival. And then you may start appearing as a burden to the family.
Of course.
Because some people get frustrated, this one person taking up
all the responsibility.
And they have to do that as well. And then you talk about even intimacy.
Yes.
You know, if you're male and you're not able to perform,
and
people have needs.
That's why in the vows for sickness and health, right?
Yeah, but when they're saying it, it's better to say when there's a sickness, so they know it. Because people would say things at the time because things are good, but they're supposed to be that way. And then when there are needs, maybe people need children, maybe people need, then you now start seeing that they start looking for assistance outside.
Yes.
Also known as deputies, and then that could also
that have its own problems there.
Problems, and then the other part is before if you were the prominent person in the family, you start being ignored because people see you as weak and a problem.
Insignificant now.
So that could lead to depression.
Because I was to talk about the mental aspect, to deal with all of that.
No, I just put it all out there so that you could imagine. Then, people see that this is going to be too heavy, and people require counseling. And you know, there's something called empty counseling. Say, okay, this, that, don't worry, and that. But the person talking to you goes home and they're walking with their limbs and they're good. So it's like they're not experiencing the same thing. So that being in some sort of groups where you see people with the same similar thing and people have those things help. But counseling, medication, if people are depressed, because people are different. There are some people who are strong.
Yes.
And they'll take it. The older they are, the more they accept. But imagine a young person who had dreams. That could be a little bit more weighty. So having that support system is
definitely.
Important. So, and we haven't even said scratching the surface of what
the reality. And that is what this program is about. I always say on many occasions, this is not about sugarcoating things.
Yeah.
This is about finding the truth and really sharing the information so that persons would know exactly what they are dealing with. We're not trying to hide anything. We're trying to bring all the information, and that's why we bring in the professionals that has the knowledge that we need to be able to have them disseminate them to you, so that we could all be able to make better choices and better decisions. Well, at this time, we're going to take another short break and we'll be back. Stay with us.
Hi, I am Dianne, host of Transforming Lives One at a Time.
and I would like to introduce you to our brand new segment, Good Vibes, Good News. And this is where you have the opportunity to highlight your good news. You can send your 90 seconds video to our WhatsApp number 868-701-2099. That's 868-701-2099. Let's hear some of the good news that we never hear about. Good vibes, good news. Inspiring hope. Celebrating wins. Truly grateful.
If you're wondering where to find top-tier quality tiles and products to refurbish or renovate your wall, floor or pool, well, your worry is over. Come to D-Cell's Tile and Ceiling Center, Tobago Local Road, opposite the Bonnecourt Primary School, Tobago, where you will find porcelain, mosaic and ceramic tiles of the highest quality guaranteed. D-Cell's Tile and Ceiling Center also stocks thinset, grout, tile cutters and yes, windows. Plus a friendly smile and service that's second to none awaits you. So forget the hassle and get all the quality tiles you need right here in Tobago at D-Cell's Tile and Ceiling Center. Call us today at 460-8802, 639-8281. Opens Monday to Saturday from 9 a.m.
Powerlink Graphic Enterprise, Storby Local Road, Crown Point, Tobago, for a variety of quality printing products, including banners, posters, jerseys, flyers, and more. Graduation packages, get customized grad bags, mugs, newspapers, and the list goes on. Powerlink Graphic Enterprise, open Monday to Saturday from 9 a.m. Call 269-6996. We create ideas that inspire. Are you having issues with your vehicle overheating? No worries. Check out Graham's Radiator Service for sales and servicing of radiators, installation and flushing, pressure testing, gas tank recoating, and all your radiator needs. Check them out at Philadelphia Trace off the Plymouth Main Road in Marys Hill, Tobago, seconds from the Wim Anglican School. Call 639-1094 or 299-3097. Open Monday to Saturday from 8 a.m. Welcome back. Well, as we continue the conversation, Doc, I want us to talk about the recovery process. And of course, I know it's a process. Tell us about the roles of other health practitioners, like the physiotherapists, or should I say healthcare professionals, like the physiotherapists and others in the rehabilitation for strokes.
Yeah. So this is strokes and heart attacks are nothing simple.
Yeah.
And in every type of medical emergency or anything that requires a patient to come to hospital and seek attention and possibly be admitted, we all rely on a team-based approach.
Okay.
And in a team-based approach, everybody is seen as equals. Obviously, the doctor is seen as the leader of the team, but really and truly, everybody's role there is very important. So specific to stroke and heart attacks, for strokes especially, for both sides, you're going to need a team of dedicated nurses because they're the ones who are checking the vital signs and changing the patient, making sure they're getting medication, reporting back to the doctor changes and so on in the acute care. And then you have the therapists. They are very critical in stroke recovery as well as heart recovery. The simple reason is that when this occurs, what the doctors do to stabilize the patient, diagnose, stabilize, and institute treatment, which is the acute care. But what happens after the brain has suffered the insult? The brain tries to, they say the brain has plasticity, they call it neuroplasticity. The brain tries to reorganize itself to have new neurons, to do the work, start learning the work of the damaged part of the brain.
Right.
And the only way you could do it is by stimulation and coordination. Because the weak side of the body, there's nothing wrong with it. The problem is the control center from the brain. So
Right.
the brain reprogrammed another part. By reprogramming, needs stimulation from that. So that's where physiotherapy comes in.
Okay.
And the brain is at its most likely recovery, whatever could recovery, within 90 days. So the first day, as soon as the patient is stable, is very important. So the physiotherapist is there. The speech therapist is also important, especially if the person is having difficulty talking, to start training them right away,
Right.
as well as ensure that they're able to not, the type of thing they're going, if they could swallow,
Yes.
make those decisions and so on. The occupational therapist also comes in because the patient has to be independent. So see how, teach them how to behave. If it's one side the hand they have, how they could put on their own clothes.
Yes.
Because the person may not have anybody home to do certain things.
Right, got you.
And or they also visit the person's home to see that the place is safe and make recommendations of how to adjust the bathroom or the
Right.
guardrails and that sort of thing. So occupational therapists play a role. The nutritionist also plays a very big role. Obviously, the type of diet, if they can't swallow, if it's going to be a liquid type of diet or
Yes.
mechanically soft, and what the calories and the sugar content, the salt content, the vitamin content, those things are very important. So after someone has had a stroke, the physiotherapists come in, and in doing that, because if the person does not do rehabilitation, the word vegetable comes in. In other words, the plant that sits in a place.
Yes.
And what happens to the muscle? Any muscle you don't use starts to atrophy.
Okay.
Okay, and when it starts to atrophy, it gets stiff and you can't move it again. The other thing too is that the neuroplasticity thing, where the brain can start to train part of the brain, is like if you're right-handed and you lose your right arm, you start learning to write with your left.
Yes, of course.
That is the neuroplasticity, which you have 90 days to do. The therapy helps the person to start doing that. It also helps the person also, and in doing that, they're not just moving the hand and telling you sit up, they're also trying to talk to you, encourage you, and so on, and that does a whole lot for your, your mood. If you're depressed, if you need to call in a psychiatrist, you could do
Yes.
that. Similarly, the brain and the heart part of it too is very important, because you have to do what's called cardiac conditioning, which is about 4 different stages of it. The acute phase, when you're saving the life of the patient in hospital and stabilizing them, and then we don't have those facilities as such in this part, what they call a cardiac rehab center, manned by doctors and the necessary personnel, where the patient is now certain aerobic exercises to start conditioning back the heart,
Right.
individualized therapy, as well as that is where nutritional therapy comes in to be reinforced. And that is also because and also teach the brain to start adjusting, to not push the heart very fast. It starts adjusting to those conditions.
Because sometimes you're anxious to get back
exactly
to where you were.
Okay, and also starts to reprogram the heart in such a way, based on the type of exercise the person could do, to adjust the way it demands oxygen. You know, and as the person starts to build in that their cardiac tolerance to the point they can. So that's what those rehab, and then they eventually come out of the center, start doing it on their own, and seeing the doctor eventually long term doing that. So you require all these healthcare professionals, dietitians, nutritionists.
Well, I like how you put it. It's a team effort,
It's
because
a
many
team
times
effort.
you just look at the physician and you fail to recognize the therapist, the nurses. It's a team effort. So I
It's a team
like how
effort.
you put that in there, so we know, don't just focus on any one individual, but it's a team that's working together so that the patient could be well again. That is very good. But let's talk quickly about aspirin. Should aspirin be used to avoid another stroke?
Okay, so the thing with aspirin is it's a double-edged sword. Aspirin, it's not really a blood thinner, it's an antiplatelet drug.
Okay.
The real blood thinners are things like warfarin, or the or the other newer drugs,
Okay.
like Xarelto and those other things. Yeah. So what happens is that the double-edged sword is that it's when a stroke occurs, it's platelets coming together and clumping up, and then fibrin comes and forms a clot. So that if you can stop that platelet aggregation, which is what aspirin, acetylsalicylic acid.
Right. That's the baby aspirin.
Yeah. So, no, but when the stroke is occurring, you go for the full shebang.
Oh, okay.
You take about 325, baby aspirin is 81 milligrams, so you may need to take 4 of them at one go, but later maintain with 1 aspirin. And in fact, sometimes they might even use another one they call clopidogrel or Plavix, which they use in heart attacks anyway. Okay. And then you also have to put in a statin drug. But anyway, your question was an aspirin, so let me not give you all the drug. Yeah. Now, but when it's a stroke, you're dealing with a heart attack. They say chew an aspirin even before you call the ambulance.
Right.
But when it's a stroke, do not give anything.
Okay, yes,
because you
don't know
know
what kind of
if
stroke.
it is a bleed or a clot. So they say, listen, better not do anything.
Nothing.
Because God forbid it's a bleed, you might be the one that killed the patient or worsen their condition. So, but if it turns out you do the scan and you see it's a blockage and so on, by all means, aspirin. But you talked about prevention, not the treatment. So with the preventive aspect of it, there's primary prevention, means you never had a stroke before and you don't ever want to have a stroke.
Right.
Now, you now have to weigh 2 things. Aspirin could cause bleeding in the body, bleeding in the gut, the stomach, ulcers, and so on, depending on the person. And the older you are, the more prone you are to it. Okay. So you're going to ask yourself, should I give them an aspirin for a stroke they may never have, but start treating them for massive bleed with? They might even need to operate to do an ulcer.
Right.
Or do I think? So rule of thumb, because the question keeps coming, because for the one person that has the stroke, he don't care about the 99 that would never have had it. So research comes out, but usually say between the age of 40 and 60, they use that age, because younger than that, there's no real reason for aspirin.
Right.
They have what they call a cardiovascular disease complication index for what if the person is going to have a cardiovascular event within 10 years' time.
Okay.
And the risk factors, and if it's up to 10%, then maybe you could start considering aspirin. They say consider it. It's individualized. The doctor will make a decision. And those risks, when you plug it in, includes hypertension, diabetes, and that sort of thing. If the risk is low, there's probably no need for an aspirin, unless you're having a heart attack, which is a different matter.
Right.
Then use aspirin
Totally
for that. But prevention, above 60, they say no, not really. But if the person has had a stroke before, and it's obviously that is secondary
they don't
prevention,
want a recurrence.
You have to leave them on the aspirin. That one, they don't have the stroke. They've had the stroke already.
Right, yes.
So you're now preventing it from having a recurrent one. But the primary one is where they never had it.
Yes.
So that decision is made by the doctor, and he has to take other things into consideration, knowing that there's a bleeding.
Of course. Well, Doc, I want us to talk about modern life-saving treatments. What are now available as it relates to strokes and heart attack, as we begin to bring the curtains down? Okay, so
let's deal with the stroke first. So with the stroke, you have to restore circulation to the brain, and you have to do it between a period of 0 time to 4 to 5 hours time. After that, unless they do a scan and shows that it's still salvageable, some people may even take it up to 9 hours to intervene. Okay. So if you're in a place that has that facility, they have those ambulances, or you could get them to the hospital in time. So a patient a relative is having a stroke, try to get them to the hospital ASAP, call a cab, call the ambulance.
Yes.
Know that time is of the essence. It's not the transportation, but it's the time within the time. And you're hoping that the scans are working wherever you're going, and the people recognize it's a stroke, because sometimes they may keep them in the side. They get a scan. If there's no bleed, then they give them a thrombolytic therapy. TPA, tenecteplase, but there's always a risk of a bleed. That's a complication, but I won't go into that, but that could save. But there are some situations where the clot is so big that giving those clot buster medications may not work. So if you have what they call a neuroradiologist, interventional radiologist, or somebody trained in that, they could slip a catheter up all the way through the groin, all the way up to the brain, up to the area where the clot is. And with a guide, on the catheter, they open it up. It has like a basket thing that holds onto it, and then they pull the whole clot right out.
Wow.
Yeah, required to have the imaging center somebody trained so they don't go into the wrong place.
Of course.
And cause more damage, and obviously the other complications. But that could, if you do it within that period of time, but you can imagine from time you call, you can't get anybody and so on. Time is going, and sometimes by the time you get there, it's too late to do anything. But those are the ways to do that. For the heart attack, That one is a little bit more straightforward. You chew an aspirin, like I said, and they get the person to the hospital.
Yes.
But the time is shorter. It's usually they say to do an acute intervention, you have to do it within the first 1.5 hours, 90 minutes.
Wow.
Yeah. They put in it's called percutaneous coronary intervention. They're pushing this thing up the way, the catheter, with the cath lab. It's called a cardiac catheterization lab, where they could image and follow with dye, and find the blockage. And then when they get to the area that's occluded, they blow up a balloon, and then they put in a stent to keep it open, and that restores circulation. Once you do it in time, you save the muscle. The alternative, if you don't have a cardiac cath lab and train people to do it, is to give a clot buster. Methylase is what is used here, or tenecteplase is for the brain, methylase is one. And hopefully but if that doesn't work, then you have to lift the person to wherever.
Wow. Time is of the essence.
Yeah. In some people, they arrive well past the time. They've been at home taking it. They don't want to go to hospital. They don't want to go to hospital. So they're still alive by the time they get there, but the damage has already been done. So what you're now giving them medication is to prevent another area from infarcting. So in those people, you're going to give them aspirin. You're going to give them clopidogrel, it's dual platelets. You're going to put them on heparin. You're going to do ECGs. You're going to do an echocardiogram. You're going to do, there's a whole bunch of things. Control blood, on the things that cause it, you control blood pressure, the sugar, and all these other things. And so that is
That's it. Wow. Well, Doc, as we begin to wrap up today's program, I'm going to just give you probably about 45 seconds to leave one thing that would resonate with our viewers on this entire topic of strokes and heart attack.
Yeah, so to the viewers, those who haven't had a stroke or heart attack, this thing is real. It could happen to anybody. It could happen to you. So do not take it. You've heard about the complications, the loss of independence, loss of work, loss of income, loss of self, and depression. And so that you have to know your numbers starting today. Find out, check your blood sugar, check your cholesterol readings, check your blood pressure, know your family's history. Try and exercise at least minimum 5 days a week, half an hour of at least moderate intensity, fast, brisk walking or running if you can. Avoid alcohol. Avoid smoking anything, whether it's cigarettes, whether it's weed, marijuana. In fact, it's healthier to eat your vegetables than to smoke them. That's my thing I'll leave with you. Alcohol, sedentary lifestyle, and always obey your doctor's instructions. Take your medications. Don't say, I'm feeling good, I only take it when my pressure high, and all those other things. Take your vitamins and try and be happy. Avoid stress. If stress doesn't avoid you, get your coping mechanisms. Still, despite all of that, things may happen, but at least you know you've done your part.
Yes, well, thank you so much. I like so much that you said here. So much that you said here today that I'm booking you one time for a part 2. We're going to talk about some other things.
They say no good deed goes unpunished.
Precisely. Yeah. Well, Doc, thank you so much. I want to thank you for taking time off. I know you have a very busy schedule, but you took the time off to be with us today on Transforming Lives One at a Time. And of course, we want to thank you for your service, your continued service to the people of Trinidad and Tobago, and wish you all the best in your endeavors.
Thank you all, and thank you to the audience.
Yes. Well, folks, that's where we leave it for today. I am your host, Dianne Mcletchie, and of course, you can check us out on all our social media platforms. We are on YouTube, Instagram, TikTok, and of course, Facebook. As usual, I leave you with the definition of transformation, which is an internal shift that brings us into alignment with our fullest potential. Hey, we've got this. See you next time. I will leave you with beautiful sceneries of Tobago.